Hello. Our guest today is Gary Freed from the University of Michigan, where he's professor of pediatrics and professor of health management and policy. Welcome, Gary.
Thanks so much for having me on your show, Bruce.
Terrific. So, Gary and I have known each other for a long time, and Gary is one of the world's leading pediatric health services researchers. He started two very successful healthcare research institutions. And today, among his many roles, he is the director of the Michigan Child Health Improvement Collaborative. I know Gary mostly through the 20-some years. He was a member of the advisory committee of a health policy research program that I directed, and for much of that was also the director of that committee. So, Gary, I want to hear from you about your perspectives, not only as someone who's given advice to people in Israel, but also someone who's chaired an entire group that was giving advice like that. I want to help us all understand what makes it work. So first of all, from your perspective, why do people from the U.S. sometimes volunteer, busy people, prestigious people, why are people willing to contribute time to give advice to colleagues in Israel?
So I think that's a really great question. I would say that first and foremost, that there is somehow, some way, a connection to the state of Israel and to the people of Israel, and to the belief that whatever kind of contribution they can make, and we all make different contributions, whether those be in a professional sense, whether they be in a volunteer sense, whether they be in a financial sense. Different people have the ability to make different contributions. And I believe that for those who hope to make a difference and believe they have something to offer, they're willing to engage. And I think for different people, the motivations could be slightly different. For some people, if the meetings are in Israel, they might like to go to Israel every year to attend a meeting. For those with a particular area of expertise where they think they can actually help and that their advice or expertise is actually utilized, they feel like they're valued and they're making a difference. And then lastly, if part of that advice also has to do with mentorship of a new generation of investigators, then I believe that it also creates the opportunity for people to feel like they're doing something, not just for the here and now, but to also make a difference in the future of the state of Israel.
Makes a lot of sense. Thanks. So, really group or individual or policymaker who wants input from experts from abroad, what can they do to make the experience successful and enriching for the consultant from abroad?
So, a couple of things. Let's say these are volunteer organizations like ours is, the one that you and I work with. Then there has to be a sense of tachlis. There has to be a sense of actual meaningful questions, not performative questions. That people both understand what the Israelis understand what exactly the expertise is that they want and that they need, that's able to be articulated, and that the opportunity arises for the committee member to both meet with people who have that clear vision and also, on occasion at least, with people who may be decision makers who might act on that advice. Now, it's naive to think that all the advice you give is going to be taken. That's not the way the world works. However, the notion that that advice or that information at least forms some kind of basis on which decisions might be made, whether or not they're the recommendations the committee member gives is actually, I don't want to say irrelevant, but it's not the primary focus. The main thing is it goes into the mix of decision making, because we American experts, although some of us may know a considerable amount about the Israeli healthcare system, we don't live in the Israeli healthcare system. And no matter how much we know, we don't know as much as the people who are actually there and the professionals who run it. And so I think another thing that's important is that the people who serve on these committees recognize that even though they may be experts in their field, they have to come to the table with humility.
That's a good lead into my next question. People come get expertise from abroad in at least two frameworks. One is on a one-off basis. You want to know you're thinking of doing a residency match, so you get in touch with the person who does the residency match in Washington and you ask them a few questions, and it's a one-off thing. Another is an ongoing relationship. Ben Gurion University Medical School has an ongoing advisory board. Brookdale has an ongoing advisory committee. When you think about both of those frameworks, the types of frameworks, when we're trying to figure out who would be a good consultant, obviously one issue is that they have to have the relevant expertise. Another is that they care about Israel. Third, you mentioned before, they can't be too full up with themselves. They have to have humility. Do you want to expand on any of those, and what other characteristics do you think are important?
Correct. It's another really good question. And there's no absolute right and wrong. I want to make that clear. But my perspective is, for one-off consultations, you want expertise, and you want a just the facts ma'am kind of person to be able to help you with that. If you're looking for a longer-term relationship and an advisory committee with members that go beyond singular expertise, you want to be able to consider people who do have expertise, but also are generalists in some intellectual fashion, that they're able to critically analyze different topics and issues. They will have the humility to be able to say when they don't know something, they will qualify the expertise or the advice they might give, and that they're committed to, if they don't know something and that expertise is warranted or needed, to try and go and find it to be able to help the process forward. There also has to be chemistry. People that is on the Israeli side, that they feel they can pick up the phone and ask a question. That, yes, everybody's busy, but these are, on the advisory side, people who've made a commitment to say, this is something I believe in, this is something I want to do, and I'm happy to have an ongoing relationship that can help in whatever process they need. And this can then morph from just on a factual or topical area, but it could be advice on mentorship. It could be advice on leadership. Many of the people on these committees, if they're selected well, lead institutes, lead divisions, lead departments, have a lot of experience in a variety of domains. And so for a place like Ben Gurion University or the Myers JDC Brookdale Institute, there's a lot that goes on there. And there's a lot of leadership issues. And I think those of us who serve on these committees often reach out, sometimes to each other or to other mentors, for help. Those leadership and practical domains. If it works for the people in Israel to be able to have that, or a different view, or kind of an arm's length safe person to ask advice, everybody wins.
For sure. I've been on the receiving end of that for many years. I've had 4 different chair people, and Gary was the best. And to get this kind of input is invaluable. So Gary, I want to thank you not only for all those years of working together, but also thank you for joining us today.
My pleasure. I really appreciate it, and I encourage people who are those experts who want to serve on committees to think about why they want to do it, what they have to offer, and for Israelis to realize there are people who care and who want to make a difference.
Terrific. Thank you.